Okay, hello, I'm Dr. Herman here, and this is one of my patients, Mr. Villazone, and I pronounced that okay?
Yes, you did.
Okay. Um, he had come here through urging from his wife, who was a previous patient with fibromyalgia and thyroid condition that we treated. Mr. Villazone had suffered from diabetes and high triglycerides and psoriasis, as well as foot pain. We started with a very expensive some tests that have been run on you that have not really been run. At least the specifics of the tests that we've run have not been done with you before.
That's correct.
One of your main goals, as we started with, one of your main ideas to be able to see that this was going to work was your weight change, right?
Mm-hmm.
So that was that was the boundary of, can we do this or not?
Right.
So you had, with your diabetes medications, you're on metformin and Actos?
Actos, and also simvastatin
For the cholesterol.
and Lodasa for the triglycerides.
Right, so they had a medical pharmaceutical grade omega fish oil that they were giving him. So there were two diabetes meds. There was a cholesterol med. Was there also a blood pressure med you were on?
No, I think those the simvastatin. I think it was or the Diavan.
Diavan.
Yeah, that's right.
Yeah, so
I
he was
did
on
add
blood
Diavan.
pressure meds, and he was on cholesterol meds. They gave him to lower his triglycerides, and which doesn't make sense to me, but anyway, it was done. And how much were your medications a month?
Oof, it was easily $90 to $100 a month.
$90 to $100 a month, and that was aside from the insurance paying for meds, so that was his copayment or extra payments. With your diabetes, do you remember the numbers what you had with your HbA1c?
It was in the 120s.
Fasting glucose was in the 120s.
Yeah, 120s, and
it was
of course, while I was taking the medication.
With the medication.
And then at times it had gone up to 160 when I was measuring it.
And even with medications. And the long-term, the 3-month blood sugar, the HbA1c was?
I think that was 7, in that 7 range.
In the 7 range, which is pretty high. We want that number below a 5.7, so there's no risk for diabetes. On the last blood test that I ran with you, your glucose levels had come down into the low hundreds, if not even high 90s.
Correct.
Your HbA1c came down below 6.
It was, I think, 5.5, something in that nature.
5.4, 5.5, and that happened within, what, 3 or 4 months of working together?
That's correct.
In the first, how much weight have you lost now since you started this program?
I've lost 29 pounds.
29 pounds. And your goal was to reach 15? Was that?
I wanted to reach 160, and I'm got 1 pound left to go.
Okay.
So
29 pounds is a big deal, and there's no dietary pills that you're taking.
No, there's not.
And there's not even extra exercise that I've had you do. It's been just following proper dietary regulations.
Absolutely.
And we figured that out with certain specific labs and doing exact diet according to his immune system function. So there's no inflammatory foods going into his system, at least not much of it.
Well, at first I was real strict, and I've cheated a couple of times, but as soon as I kind of monitored my weight and put on weight when I ate certain foods, I kind of stay away from them.
So you realized what hurt you.
Yeah.
And there's no reason to stick with the diabetes. So the HbA1c came down from a 7.0 to a 5.4, 5.5. His fasting blood sugars now are at 100 or even a little bit below 100. He came down 29 pounds. He's completely off of the cholesterol meds.
Absolutely.
Triglycerides are normal on the blood test.
Yes, they are.
His 2 diabetic medications are done. He doesn't use them. His blood pressure medication is done. He doesn't use it. And something else that was remarkable is that doing this anti-inflammatory approach that we use here, your congestion, the nasal, you were using a spray for your nose or an inhaler for your nose?
Yes, I was. Mm-hmm.
And that was a daily?
Yeah, in the evenings I would put it on so that I wouldn't have issues with breathing in the evening.
And there's no more of that?
No, there isn't. I don't use it at all any longer.
So when your so this is all positive, which is great. So when your medical doctor saw your blood test, because he ran a follow-up also.
Yes, he did.
And what was his comment as well? And he knows that you're off of your medication?
Well, he does.
Okay.
At first he was surprised, and he says, okay. And actually, declared me as non-diabetic, and also said he was going to use me as a testimonial to his patients about losing weight and how the effect of it is, and did a follow-up with him, and he was very pleased with what was going on in my physical.
That's wonderful. Congratulations.
All right.
You deserve a pat on the back. You
Well,
pat yourself on the back. You did all the work.
Yeah, well, it was
Excellent, excellent. So we've got a few more things to do with him regarding a couple of other symptoms in the body, but we've come a long way, and there's a lot of weight loss and no more medications, and he's a healthier person, because diabetes can lead to a number of things like heart disease and stroke and blindness and amputation, and it is and kidney disease and dialysis. So it is deadly, and I want to thank you for sharing your story with everybody.
Well, thank you. I appreciate it, Doctor. I appreciate all the help.
Thank you.
All right.
I appreciate it.
Good.
Okay, we look forward to helping you too.